You are in the waiting room of a hospital for a doctor's consultation. You complain about your chest pain, fatigue, or dizziness, and anxious about any serious issue. You have been under treatment for 6 months without any relief. But on seeing the report and all the investigation, your doctor waves it off as stress or anxiety. Only you need to change your lifestyle. In another scenario, you complain of your digestive problem frequently troubling you, and you are consulting the gastro doctor for 12 months with the varied doses of the medicine, but no results, and explain him your predicament. He dismisses immediately, saying you are overweight. Reduce the weight, you will be alright. In yet another scenario, you feel chronic pain or fatigue, but your doctor insists your tests are normal and suggests it is only psychological. Look, in all the 3 cases, doctors prevail upon you that their line of treatment is right and the problem is only with you because of aging or stressing or overweight. Sound familiar? If yes, you might be a victim of medical gaslighting. And trust me, you are not alone. Welcome to today's video where we uncover the hidden truth behind why some doctors engage in medical gaslighting, how to detect them, the impact of gaslighting on you, and how you can fight back.
Medical gaslighting happens when doctors dismiss, downplay, or manipulate a patient's concerns, often making them question their own symptoms or pushing them toward unnecessary treatments. If a condition is not easily diagnosable, some doctors prefer to blame the patient instead of admitting they don't know the answer. Even if you ask intelligent questions based on your desk research, instead of addressing them, your doctor shuts you down and insists he knows the best. Some doctors see informed patients as a threat to their authority. They would rather have unquestioning compliance than engaging in discussions. Some doctors downplay age-related issues because they assume there is no real solution to think patients are overreacting. Some doctors rely too much on generic advice like drinking more water and avoid dehydration instead of digging deeper or personalizing treatment. Medical dismissal happens more often than we realize. Now, this medical gaslighting will have serious effects on you. You become victim and often feel anxious, depressed, and isolated. You start questioning your own reality and may lose trust in the healthcare system. You will be pushed to discount your self-worth. Being told that one's experiences are not valid can significantly undermine self-esteem and confidence in one's ability to understand their own body. Low self-esteem can affect various aspects of life, including personal relationships and professional endeavors. With gaslighting, sometimes diagnosis and treatment are delayed, leading to severe health complications as long-term consequences. But why some doctors engage in these practices of gaslighting? Number 1, time constraints. With limited consultation time, some doctors prefer quick disposal rather than deep investigations. They are not giving patient listening to the patients for their symptoms. Number 2, arrogance and dismissiveness. Some believe patients don't know their own bodies and arrogantly dismiss concerns too quickly. They even silence the accompanying spouse for avoiding any detailed engagement. Number 3. Fear of legal liability. Most doctors do not overindulge in diagnosis but rely on machines and overprescribing tests and treatments, hoping that will protect them to avoid legal suits in case something goes wrong. Number 4. Lack of knowledge. Some conditions like autoimmune disorders or rare diseases are not well understood, leading to misdiagnosis or dismissal. They do not entertain the patient's own study, as this will push them to investigate on a different treatment. Number 5. Corporate pressure and revenue targets. Many hospitals push doctors to meet financial quotas, leading to unnecessary treatments and tests, forcing patients to surrender. Now, how can you be alert to identify gaslighting signals, even though many doctors are service oriented? Here are some common signs that a patient may be suspecting medical gaslighting. Number 1. Lack of engagement. When doctors frequently interrupt you or do not allow you to fully express your concerns, your questions or requests for additional diagnostics are ignored or dismissed, and your symptoms are not taken seriously. Number 2. Emotional impact. When you feel ashamed or embarrassed after discussing your symptoms with your healthcare provider, and you are made to doubt your own perceptions whether your symptoms are real. Number 3. Discouragement from self-education. You are discouraged from educating yourself about your condition or searching in Google. Number 4. Power dynamics. When the healthcare provider acts as a gatekeeper, controlling the validation of your symptoms, it can lead to feelings of powerlessness. Number 5. Systemic biases. When doctors are biased with the patients of certain class for treatment, recognizing these signs can help patients advocate for themselves and seek appropriate care.
We will see now how to protect yourself from medical gaslighting. And medical gaslighting is real, but you don't have to be a victim. Stay informed, stay firm, and always advocate for yourself. Make sure you are heard by your doctor. You fixed an appointment. You waited for your turn. Very importantly, your previous patient was taking a long consultation time and you are waiting restlessly. One consolation would be, at least you can also take so much time with the doctor for a detailed diagnosis. But to your disappointment, you are dismissed immediately that the solution is only in your hands. Since you know the pain of fixing and waiting for appointment, you need to prepare well to increase your consultation window time. Number 2, be firm and ask questions. Push for answers. Write down all your complaints and base your discussions on that note. Don't accept a quick dismissal. Ask, what else could it be? Ask all relevant questions like what, why, when, how, etc. You are paying the fee. You are entitled for audience and not a charity. Number 3, physician first. It is better to consult the physicians first for some ailments instead of the surgeon. Surgeons invariably suggest an operation in the place of treatment. It is true, the person with a hammer on his hand will always look only for nails to be hammered. Number 4, bring a symptom log. Write down when your symptoms happen, their severity, and how they affect your daily life. Surprisingly, they ignore all the symptoms but will ask the matching symptoms to their assumed diagnosis. Number 5, trust your instincts. You know your body better than anyone else. If something feels wrong, don't let your doctor gaslight you into thinking it is nothing. Number 6, get a second opinion. If you feel unheard, you only have a choice to see another doctor. A fresh perspective should change everything from stereotyping. Number 7, bring a friend or advocate. Having someone else in the room makes it harder for doctors to dismiss your concerns. Such experiences often lead to a loss of trust in healthcare providers and the healthcare system as a whole. In summary, medical gaslighting can have severe and lasting effects on patients' mental health, like increased anxiety, depression, trauma, low self-esteem, loss of trust in healthcare, and social isolation. These effects can be particularly damaging due to the authority and trust typically placed in healthcare professionals. We need to work together to raise awareness about medical gaslighting and create a healthcare system that listens and believes us. This can happen only when we dialogue with the doctors and establishing the patient's right and power. Don't be cowed down with what they say, but raise all health-related questions, even if they reject you, that you are not a doctor. You insist you are entitled to know the ailments because it's after all your body. Only big questions will get the big answer. Your health is real and your voice matters. Don't let anyone make you doubt that. Do not allow them to treat you lightly when you feel invalidated. Thank you for watching till the end and please comment your experiences below. Don't forget to like, share and subscribe the channel.